appreciating the pocket depth of 5 mm. Yeah, so I think if I did not feel that 5 mm, I wouldn't have suggested maybe to take an X-ray.
Okay, that was nice. I also found it good that you were systematic in your examination, and you didn't miss any points which could be. This is a difficult case to detect clinically, but taking a bite wing helped you greatly. So you followed the systematic steps, so that was good.
Yeah.
Right? So good, very good.
Okay, thank you, sir.